This video is for informational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician with any questions you may have regarding a medical condition. Always consult with your physician before starting any exercise program or doing anything contained in this video. Always stop if you experience any pain, discomfort, or difficulty in performing anything described in this video.
After a long stressful encounter with the COVID-19 virus, finally relief to get access to the vaccine. Getting vaccine is essential as it protects against the virus. Don't get vaccinated on an empty stomach. Eat food rich with antioxidants, eat leafy vegetables as you go for vaccination. Drink plenty of water, get enough sleep. It has few side effects, which may be a sign of body's immune response to the vaccine. Symptoms like mild fever, muscle and body ache, pain at the injecting spot, headache, fatigue, diarrhea. Experiencing no side effects doesn't mean the vaccine is not effective, because everyone's bodies respond differently to the vaccine. Side effects may up to 24 to 48 hours. Consult a doctor if it lasts longer. Care after vaccination. Drink plenty of fluids, avoid sugars, eat anti-inflammatory food like turmeric, garlic, ginger, eat green vegetables, fresh fruits also. Take proper rest. Now the question is, can you do exercise after getting vaccinated? Working out before getting the vaccine is best thing you can do. But what about after getting the shot? Yes, if you feel good, not to train hard or do any sort of high intensity activity. If you feel good after few hours of getting vaccination with little to no symptom, then you can perform steady activities, low intensity training or yoga asanas like pranayam, Bhramari pranayam, dandasana. Take good rest after performing these activities.